When should you seek help? Well, generally speaking, a lot of people with back pain kind of wait and see what happens, which is pretty normal. And in most cases, the back pain should, kind of go away within a few weeks, probably about 4 to 6 weeks. However, within that 4 to 6 weeks, if you notice that there are any changes such as bowel or bladder issues, like trouble going to the bathroom too much, if you notice that the pain in your back is getting worse, and or now you have leg pain that you didn't have before, numbness and tingling in your leg, that's something you should definitely address, as well as any knee buckling or weakness in the ankles from walking. Also, if you've experienced a fall, that's something you shouldn't wait and see about. You should definitely get checked with that immediately. How does physical therapy help? Physical therapy helps a ton when it comes to back issues. Most of the time, patients can get help immediately and should seek help immediately when they have back pain. Because even if you wait and see, and yes, it does get better, we can actually help it get better a lot quicker than waiting 4 to 6 weeks for it to get better on its own. Also, a lot of times, costly tests, x-rays, MRIs especially, will indicate things that we can actually tell you about on your evaluation, and you wouldn't need to spend all that money to go get the MRI. The MRI kind of just gives you somewhat of a diagnosis or picture as to what's going on inside, but even in an evaluation with a physical therapist, based on your subjective history and what you present, like, we can actually be able to tell you those things without the costly MRI being in the case. If you go and get one of these tests, pretty much, especially an x-ray, past a certain age, you're pretty much going to find something going on anyway, but is that really the source of your pain? We can actually figure out what the cause of your pain is, and getting an MRI or an x-ray is just more time that's taken in trying to find out answers that we can give you immediately when you come in for your evaluation. We can find out what things will actually help you. We're going to look at your symptoms more so, instead of just basically sticking to it, a diagnosis coming from a doctor or from an x-ray or MRI. There are pretty standard exercises for certain issues in the back. However, there's lots of times I've had people come in that I expect them not to respond well to certain exercises based on their diagnosis. However, when I try them, they actually respond well to the opposite thing that I thought they weren't going to respond to. So that's another thing. The other thing is stretching, just tight muscles, working on those things. Strengthening is huge with physical therapy when it comes to the back, because we tend to use the back muscles a lot more, and we have weakness in our abdominals and our hip muscles. So with physical therapy, we can strengthen all those things, and when we strengthen all those things, that gives your back support.